Welcome to Wanja's Health Diary. The young people are a vibrant force in Africa and the world over. As we get to creating awareness on hemophilia, there's a group of young, vibrant Africans who are keen to create awareness on hemophilia. Today, we're joined by Jodarsen, who is going to tell us about this interesting group of young people from 8 African countries who are yearning to be heard. Welcome to the Wanja's Health Diary.
Thank you, Joy.
Tell me about yourself and what's your particular interest in this group, Haemophilia Youth of Africa.
Well, actually, I'm a person living with hemophilia, actually severe Haemophilia A, and my interest is mainly focused on youth, mainly leadership, because there's a lack. We found that there's a lack of leadership in the bleeding disorders community in Africa. So my main interest is to empower the youth to be leaders and kind of make a positive difference.
What are some of the reasons that make you feel that the youth have been left out in the management of bleeding disorders in Africa?
In the bleeding disorders community, as you would say, there's established national member organization that manages treatment of hemophilia and advocacy. But the thing is that you would see that they tend to think that young people don't have the necessary skills because there's a lack of training with young people. So these are the things that I'm interested in, and we want to push forward that youth and get the proper training to come forward and be leaders and being able to advocate and manage an organization.
What are some of the key challenges that you hope to address in this youthful movement that you've created and that you're a part of?
First of all, the psychosocial aspect of it, because living with this condition, you're very affected mentally, and being able to have self-confidence in yourself is something that we want to address, because where it leads to is that there's lack of involvement.
When did your parents and other family members sit you down and tell you that you have hemophilia? And what was your earliest understanding of what hemophilia is?
That's the difficulty of it when you're a child.
Yeah.
So I think that it's been a process, gradually explaining to you the things that you can do, you cannot do, and I think that you learn by experience, because as a child, as you grow, you have senses that kind of guides you, because if you're suffering, the main thing with this condition is that you suffer a lot, so it kind of guides you in life that you cannot do this, you cannot do a lot of efforts. So yes, I think that this was the thing that.
Okay, and from Mauritius, in terms of the treatment and the management of hemophilia, most of the African countries, Kenya included, is facing a real challenge in the availability of factor, whether it is for the preventive purposes or for better management of hemophilia. How have you managed it in Mauritius?
Actually, I would like to share my experience first with that, because I know how difficult it can be when you suffer, and it's been very recent for me that I'm able to live a normal life. So the most major part of my life, 25 years of it, it's been constantly suffering. So it is difficult, because constantly suffering, how the psychosocial part of it affects your mind. So working on yourself, self-confidence, it's been a great challenge for me. Basically, it's been treatment where you do blood transfusion of cryoprecipitate, and living a normal life where you get admitted to hospital constantly, nearly, especially with severe hemophilia, it's been nearly every week. So you just go to the hospital and you come out, you go again. So imagine living with this condition. How do you get your education? How do you get a normal life? How you get married? How you go to work? So basically the situation in my country is improved thanks a lot to my NMO, the Haemophilia Association of Mauritius, that managed to do advocacy. That was the government. So it's been a progressive process. We managed to get factors first, and it was still periodic treatment. And then we managed to get prophylaxis treatment for kids, which I think is very important. And then later on, we managed to get all of our patients, adults included, that have severe condition of hemophilia to be on prophylaxis. So it's been kind of maybe 2 years now that I'm on prophylaxis. So when you are on prophylaxis, your life changed completely.
How have you been involved in terms of explaining to your family members, your friends, maybe your schoolmates, and what has been the reaction?
Well, the reaction have always been very positive, because as I remember, our situation is not very old too. It's only 10 years, and it was mainly my parents, my mother especially, that even that she didn't have much information. It was mainly that we were getting at the hospital. She managed to create an environment around me that even when I was at school, taking tuitions with my friends and my family, she ensured that everybody knew about my condition and what were the risks and how to properly surround me to be able to
create awareness. Thank you so much. Thank you so much for joining us today. And you've had it. Surround yourself with people and family, and if they do not know about hemophilia, take that personal initiative to ensure that your brother, your sister, your neighbor, friend, or schoolmate knows what hemophilia is. Thank you.